Our country is close to 80% of people who have at least one dose, 40% double dose, eligible, so people 12 and older, to be clear. What do you think that means in terms of getting back to normal, Dr. Labos?
I think it means that we're going to be in a very good position come the fall. The worry that I think a lot of people have is that come the fall, when the weather gets colder and people start spending more time indoors, when viruses spread more easily, could we see a resurgence of cases? And that's very possible. We've seen hints of that happening in Europe, in Israel, and South Africa because of the rise of the variants. So could that happen in Canada? And the answer is yes. The trick or the key to all this is going to be is that if we can double vaccinate everyone, yes, we may see a resurgence of cases in the fall. But if everyone's vaccinated and these are not severe cases and people are not landing in hospital, we may see a decoupling of the total case count and the number of hospitalizations. Up until now, those two things have sort of tracked together. But if we can uncouple those, and if it so happens that we see new cases, but they aren't landing in hospital, then we should be relatively okay because the healthcare system is not going to become overwhelmed. So that's really the goal, if you will, is to make sure we can double vaccinate as possible so that we are in a good position to withstand whatever new variants, whatever resurgence might come to us starting in the autumn.
You know, there are always people who are optimists and pessimists, and so you do have people who are now starting to say, well, what about the Delta variant? What about the Lambda variant? What's that going to do? And others who say, you know, we're doing pretty well and we shouldn't catastrophize. Where do you stand?
Like most things, I probably take a middle-of-the-road approach that has served me well over the years. The situation is very good right now. Let's acknowledge that the case counts are down, the vaccine rates are going up, so we are in a very good position. The point of all of this is not so much to deal with the situation now, but to plan for the event of the future. And that's why I'm sort of saying, like, we need to position ourselves in a good place to be ready for the fall, because even though things are good now, we can't become complacent. The situation could change. And, if you look to Israel as an example, they had lifted their mask mandates, saw a resurgence of cases, and then had to reintroduce them. And I think we have to realize that our plan has to be a dynamic plan. So things are good now. We can do things now. It's summer. People are outdoors. The risk of viral transmission is much lower. But 2 months from now, the situation might change. So we can't pretend like what's true today is going to be true 2 months from now. We may have to alter the plan, and we have to be prepared for that degree of flexibility.
Thanks for this, as always. Appreciate you coming on the program.
My pleasure. Take care.